If you don't know me, yeah. I'm Nancy Aries. I'm the interim dean of the Marxe School, and it's really my honor to welcome you to this Marxe talk, Challenging the U.S. Healthcare System. You don't need permission to start. The title is an important reminder of that very fact that we don't need permission to repair the world. Marny Smith, who's known to many of you as a former student and associate director of career services, turned personal tragedy into a drive to change standard obstetrical protocols. Based on what she learned following her son Heath's death, she decided that women and their families should not have to experience what happened to her, that there were better ways to care for women in their last trimester of pregnancy, been demonstrated already in countries such as Scotland and accepted into protocol in the National Health Service, where the rate of stillbirths has declined, while the US ranks 48th among high-income countries for the reduction of stillbirths. Marny's work brings several issues for me into focus. As a School of Public and International Affairs, we tend to approach policies such as this from an institutional perspective. We look at the public, nonprofit organizations and how they assess and revitalize their work. Less time is often spent on the role of advocacy and how change can be brought about when your voice is not represented in the organizations who are responsible for your care. And this is the place where Marny began, learning, building alliances, and ultimately formalizing what she began with the founding of PUSH for Women Empowered Pregnancy. Marny also teaches us a lot about the courage it takes to fight to be heard. Medical care has often resulted in greater harm to women than good. There are many examples, beginning with the higher maternal death rate resulting from physicians as opposed to delivery provided by midwives. Women have had a hard time being heard, but Marny is insisting on that very fact. You need only to Google stillbirth prevention, and you'll see that. So I could go on, but this is a time for Marny's voice to be amplified. So let me introduce Jessica Greene, today's moderator. Professor Greene evaluates health reform-related policies and strategies intended to improve the quality of healthcare, including financial incentives, public reporting of provider quality, and consumer engagement. She's published widely in top health policy and primary care journals, including Health Affairs, Milbank Quarterly, and the Annals of Family Medicine. Prior to joining Baruch's faculty in 2016, she was a faculty member at George Washington University and the University of Oregon. At Baruch, Professor Greene teaches classes in statistics and health policy. She earned her doctorate in public administration at New York University and a master's degree in public health and international affairs at Columbia University. So let me turn this over to you, Jessica.
Thank you, Nancy. Welcome, everyone. It's so nice to have so many people here today, and it's really nice to see some names of former students, so welcome. To start our conversation, I just want to explain how I first met Marny, which was the summer of 2020. At that time, she was the assistant director of the Marxe School's Career Center, and she had graduated from the program just a few years earlier. And she emailed me a very striking note, which I'll read to you. She wrote, "I took Don Weissenen's communication strategies class in 2017, and I spoke with him over the summer about the lessons I learned in his class and how I'm applying them to the real world. I told him the story of my son, Heath, who was stillborn at full term in September 2019. I've become very involved with stillbirth prevention advocacy, and he said you'd be a great person to speak with. I'm interested in replicating the National Health Service's stillbirth prevention program in the US, and I'm in touch with Ariadne Labs." So I was pretty struck by this note and also by our subsequent conversation. Marny was taking a tragedy, the death of her son, and using lessons from the Marxe School to improve the healthcare system in the United States. And for those of you who aren't familiar with Ariadne Labs, she was working with an extraordinary partner. It was founded by Atul Gawande, the surgeon and New Yorker author who is now a senior official at USAID. So when Marny and I spoke that summer, it was clear to me what she was doing was just remarkable. And I thought she should tell her story. And I mentioned that the leading health policy journal, Health Affairs, has a narrative section where high-profile healthcare narratives are published. And as you likely know, in January of this year, her story of bringing stillbirth prevention to the United States after her tragedy was published. And I'm really proud of her, and it's a pleasure to be with her here today so she can share her story with you. Welcome, Marny.
Thank you so much, Jessica. It's an honor to be here with you and with the Marxe community.
So Marny and I are going to talk for about 35, 40 minutes, and then there's going to be time for you all to ask questions. At that point, the chat will open up. Right now, I think you can't put anything in the chat. But to get started, Marny, could you please read us an excerpt from your article about giving birth to Heath?
Sure. I got my copy of Health Affairs right here. Everybody can read it online for free. So the title, which I'll just mention for a second, is After a Death, Bringing Stillbirth Prevention to the US. The original title proposed by the editor was After a Loss. And I do use the word loss, and I think it's accurate. I do think it's a little bit soft. And because there's so much misunderstanding around stillbirth, I really wanted to make it clear what stillbirth is. And so I suggested After a Death, and they did change it. Okay. My son Heath was stillborn on Saturday, September 21st, 2019, at a prominent hospital in New York City at 36 weeks and 6 days, almost full term. This experience, after an otherwise normal and healthy pregnancy, was devastating, crushing, and life-changing. On Friday, September 20th, I remember telling my husband that I hadn't felt Heath kick that evening. Neither of us had been educated on fetal movement, how important it was to keep track of your baby's movement patterns in the third trimester, and to report any changes to a doctor immediately. Heath always kicked in the evening, usually when we were having dinner and when I was going to sleep. But that night there had been nothing. Should I call the doctor? My husband asked. Exhausted, I said I just wanted to go to bed. I fell asleep quickly, but awakened around 4 a.m. on Saturday morning to stillness. I woke my husband up. The baby hadn't kicked me all night. My husband called my obstetrician, who said go to the hospital right away. It was still dark when we got into a lift to go to the hospital. My doctor had called ahead, and they were expecting me. Even so, I ended up waiting 30 minutes to be seen. When it was my turn, I was hooked up to an ultrasound machine while a sonographer tried in vain to find my son's heartbeat. She went to get a doctor who quickly evaluated the situation and said the words no expecting parents ever want to hear. I'm sorry, there is no heartbeat. I knew immediately that my son was dead and that I would have to deliver him anyway. In my 20s, becoming pregnant and going through labor had been two of my biggest fears. The thought of the discomfort, the pain, the bleeding, the possibility of tearing, it all made me want to run and hide. Now here I was, and the circumstances were 1,000 times worse than my worst nightmares.
Thank you, Marny, for sharing that. Can you tell us how you came from that point to realize that you needed to challenge the US healthcare system?
Yes. So after Heath died, stillbirth was not on my radar. So I ended up doing a lot of research around it. And I learned that 23,000 to 24,000 babies are stillborn in the US every year, which is really an astounding number to me. And to put that into context, stillbirth claims more children's lives in the US each year than preterm birth, SIDS, car accidents, drowning, guns, flu, fire, and poison combined. So it's really quite staggering. And we are warned about all of these other things, but not about stillbirth. So during my research, I learned that in Scotland, the chief medical officer at the time, Dr. Catherine Calderwood, had been able to reduce the rate of stillbirth by 23% in five years. So there's this great video of her on YouTube explaining how she did this and all the pushback she received. And honestly, and the pushback is from her colleagues, from other doctors who, expressed fatalism and were honestly quite complacent. But she was successful. And I thought, why are we not doing that here? And I'll quickly mention the 5 interventions or 5 tenets. They're not even interventions that she did in the UK. So the first is educating patients about fetal movement, better monitoring of reduced fetal growth, better monitoring during labor, reducing preterm birth when possible, and reducing smoking in pregnancy.
So, and there was a book that you read in Professor Don Weissenen's class that helped you sort of spark you to do some work. Can you tell us about the book and what it did to help you in this direction?
Absolutely. And I'm going to show everybody the book. This is a plug. I don't get any money for this, but this is a really great book. So in the book Switch, the subtitle is How to Change Things When Change is Hard. And one of the stories in the book, and there's great stories in the book, is about Don Berwick, who is the founder of IHI, the Institute for Healthcare Improvement. And he and his team basically realized that 100,000 people were dying every year in US hospitals due to medical injuries. And in 2004, at a national conference, he basically challenged the doctors in attendance to join him in saving 100,000 lives. And this was called the 100,000 Lives Campaign. He proposed 6 interventions. The main one is as simple as giving patients their medication on time. And he convinced a majority of hospitals in the US to join him. He said, some is not a number, soon is not a time. And he said we were going to save 100,000 people in the next 18 months. And when the 18 months hit, they had actually saved 120,000 people. So Don Berwick did not have authority over these hospitals. He did not and could not pay them to do this. He basically presented indisputable evidence, and then he convinced them that it was the right thing to do. So everybody knows how complicated the US healthcare system is and how unfair. But this to me was an example of sweeping change on a grand scale that saved many, many people. And it really gave me hope that this can be done and things can change.
And so you saw there was potential for change and you saw a path to change, but what made you decide this is your role?
So yeah, it's, I mean, I was, to be honest, obviously when your child dies, there's so much grief, and part of that is anger. And for me, luckily, I mean, my anger had a purpose now at this point. So that was what really urged me on, how unfair it was, how I had been very blindsided about this, how I was not educated about this or empowered to make the right decisions in my care. And I'm Jewish, but I'm not religious. But in the Talmud, there's a quote that actually says something like, if not me, who? If not now, when? And I really thought, and I did a lot of research and said, I found really like nothing being done on stillbirth prevention. There's a lot being done in bereavement, which is really important, and support after a baby dies, but stillbirth prevention, the US is really not doing anything. And I said, if I don't do it, who's going to do it?
So one of the things that struck me is how proactive you've been. I mean, not only deciding you were going to do it, but you reached out to the author of that book. You reached out to Don Berwick, who is an absolute icon of healthcare improvement. What gave you that, I don't know, power?
Yeah, I mean, definitely the anger that I mentioned, but when you lose a child, you basically lose everything. And so therefore I had nothing to lose reaching out to all of these people. And of course, I did not know Don Berwick was such a well-respected person in healthcare at that time. So, and both of them responded to me, by the way, and the author of Switch has actually donated twice to my fundraiser, which is amazing. And he sent me a copy of his other book. So I had nothing to lose, as I said, but also people are more generous than you might imagine.
So tell us about your work to bring the Scottish approach to reducing stillbirths here to the United States.
Sure. So as you mentioned, I worked with Ariadne Labs, and their work basically focused on studying and modifying the NHS Saving Babies Bundle version 2. And that was over a 9-month period. So they were doing a number of things. They have this proven innovation methodology that they use, and it's specifically for healthcare implementation. So it was using that. They did an intensive literature review. They did qualitative interviews and focus groups with people from other countries, previous implementers who had implemented the bundle, whether it was in Scotland or England or Australia, as well as potential end users in the US, meaning doctors who might potentially use this in their work, OBGYNs or MFMs, and also patients who had experienced stillbirth and also live birth. And the team at Ariadne basically were working to reconcile differences to adapt this bundle to the US. So for example, the US doesn't have a national health system like in the UK. So the government and the healthcare are one, right? And so if government says this, healthcare does it. We don't have that. So they were basically looking to reconcile a number of factors to create different approaches that would be successful in the US. And I will say that, this is my imagining of this was like a 2-phase project. I definitely want to say it's a marathon, not a sprint. So I knew this was going to take time, and especially because there are all these reasons why stillbirth is not being worked on in the US. But yeah, it's phase 1 ended the end of 2021. So it did happen, and it was completed.
And you mentioned fundraising. Can you talk about how this work has been funded?
Sure. So Jessica, there's so many classes I wish I took in Marxe. So many more classes. So I don't have any experience in grant writing or fundraising or development for that matter. And I didn't know how to reach out to institutions, but I knew how to reach out to people. So I literally, probably not literally, but almost literally reached out to almost everybody that I've almost ever met. And I said, a lot of people, when your baby dies, a lot of people ask you, what can I do for you? And I said, it was basically me saying, this is what you can do for me. You asked what you can do, this is what you can do. So in just a few months, under 6 months, I was able to raise about $215,000. And that's from many, many people. A lot of the donations were not huge. There were some big ones, but a lot were not. So it's all crowdfunded individually. Yeah.
And can you tell us a bit about what are the next steps in testing the bundle and be able to get it to be used more broadly?
Sure. So my original idea with Ariadne for phase 2 was to have all the answers in phase one and then just take them and jump right into implementation in the US with the goal to reduce the rate of stillbirth by 15% for 20 to 30 healthcare systems. So, and I'll also mention that at least 50 of the health systems that we wanted to work with, we wanted to be serving predominantly Black patients because it's important to know that stillbirth affects Black women two to three times more than any other race. COVID kind of threw a wrench into that and a bunch of other factors. So we are now working on what the next steps should be. We might want to do a feasibility test with the results from phase one before moving on to phase two, but I will definitely keep Marxe updated.
Great. Another one of your goals is to stop the silence around stillbirths. And could you talk to us and tell us what you've been doing in that arena?
Absolutely. So as you say, stillbirth is really a silent public health crisis. It's not well understood. A lot of times people think it's the same as miscarriage. And just to clarify, stillbirth is the death of a baby during pregnancy after 20 weeks. So at that point, the baby has to be born. It doesn't just disappear. And people don't necessarily realize that when you have a stillbirth, you need to give birth to a dead baby. So because of all these misunderstandings, including by moms and doctors themselves, a lot of people in my position mistakenly believe that it was their fault that this happened, and they go back and look at their pregnancy and they rack their brain for what could it have been? You know, did I drink too much coffee? Did I not exercise enough? And they really, on top of the death of a child, really put themselves through a lot of pain. And because of that, you know, talking about, if you think it was your fault, which every mom does, and it's not their fault, you don't feel like talking about this, right? And so talking about dead babies is just taboo in general. And, you know, I wrote in my essay, even my OB, she really encouraged me to move on and think about future pregnancies. So it's not something people feel like they can publicly mourn, and it's not a happy topic. So people just don't talk about it. And as a result, it's basically invisible in policy and programs, and underfinanced as an area that needs intervention and improvement. So as you mentioned in the introduction, I am a founding member of a nonprofit called Push for Empowered Pregnancy. This nonprofit started in May of last year, so it's not even a year old, but it was founded by a group of bereaved parents, and the number one goal is stillbirth prevention. So we've done a number of things. Actually, the first Rainbow Clinic just got announced in New York City. We partnered with Mount Sinai. A Rainbow Clinic, the term comes from the UK, where the clinic was originated. A lot of people after a stillbirth, they call the child that you have after, if you have a child after, a rainbow baby. And so this is a clinic where women will go, specifically who've dealt with many kinds of loss or high risk issues, and receive really tailored care for them, really high quality care that you would not get at a regular OB. So that's one thing that's come out of it, which is amazing. Haven't been around for even a year. We also did a onesie walk in the city. And so there are 900 babies that die in New York City alone every year. And the group of us, we pinned 900 onesies to string, rope, and carried it throughout New York City to try to educate people about stillbirth. And, you know, one of the things also to go back to switch is numbers are really powerful, but you can't convince people just with numbers. It has to be your head and your heart as well. And so putting visualization to something and saying these 900 onesies represent these 900 children. It's really staggering when you see 3.5 blocks of onesies doubled up, basically. And then I will also say we're going to march on Washington next year, but I'll send you guys more info about that as it draws nearer.
Great. So have you always been an advocate for issues you care about or health issues?
Definitely not. I did not know that I had to be an advocate for myself in health. You know, there's a feeling you trust your doctor, you defer to your doctor. And I now realize that there really is a power imbalance there. People forget that their doctor is working for them and not the other way around. So unfortunately, that was one of the very hard lessons that I learned when Heath died. But the truth is, you know your body better than anyone, and no one is going to be a better advocate for you when it comes to your health. And if you're pregnant, no one's going to be a better advocate for your baby than you when it comes to your health. So people really need to feel empowered to ask questions and even push back when they don't think a doctor is right.
Do you have recommendations for how people should advocate for themselves in the healthcare system?
I think the number one thing is speak up. And if you have concerns, hesitations, questions, if you're not clear on what a doctor's plan is, you really need to use your voice. And if your doctor isn't listening, you either need to get them to listen or you need to switch doctors, quite honestly. I always think about Serena Williams, who, if you know the story, when she had her daughter, she has a history of blood clots, and she was off of her anticoagulants because she had an emergency C-section. And she basically started like getting short of breath, and she knew something was wrong, and she knew it was related to her blood clots. And the medical staff thought that she was just on, like, I don't know if she was sedated or on other medication. They didn't believe her. And she basically had to tell them several times. And eventually there was like a CT scan that proved her right. And she had a pulmonary embolism and blood clots in her lungs. And then they basically gave her the proper medication. So, if it can happen to a celebrity, it can happen to anybody. And I think that's a case that really illustrates the importance of, your medical history better than the doctor. And so if you have ideas, thoughts, suspicions, tell them.
And can you talk about how this experience changed? I mean, it's clearly changed how you're spending your time with this nonprofit that you co-created, but how are you advocating for yourself when you're getting care in the healthcare system?
Yeah, so after Heath died, I basically waited a year to start trying again. And of course, after a loss, there are a lot of people who don't want to try again, and that's more than valid. Before I even got pregnant, though, I knew I was going to leave my regular OB because I knew that she did not have the knowledge around stillbirth and the knowledge of how to care for a lost patient. I actually straight up asked her, like, had she ever had any bereavement training? And she said no. So even not necessarily even her fault. But basically, I knew that I wanted to go to a high-risk doctor. And after you have a stillbirth, you are 5 times more likely to have a stillbirth. So I looked through my insurance. I found a high-risk doctor who had great reviews. And we did like a virtual appointment where I kind of interviewed him. And I said, one of the main things that I said was, I want continuity of care. And so can you be at every single one of my appointments, of course, barring an emergency, which happens. And he said, sure. And so when I got pregnant, I went to him, I went to his office, and 2 out of 3 appointments, he wasn't there. And, I called him and I said, you weren't there for 2 out of 3 appointments. We had this conversation. Can you be there at every appointment going forward? And basically his schedule just didn't allow it. And, I said, I understand you have a busy schedule, but I don't feel comfortable with that. And I then switched to a different doctor who I had interviewed who could see me at every appointment, and I stayed with that doctor. So of course there is, some level of privilege associated with that, being able to change doctors. And there's so many doctors in New York. If you live somewhere else in the US, you might not have that option, or depending on what kind of insurance you have. But I knew that to go through another pregnancy, I was going to need a different kind of care and a different kind of doctor.
And we should probably let folks know that you did give birth to Zosie.
Yes, I had my daughter, Zosha. She was born May 11th, 2021. She is 11 months now. She is doing great. And I credit a lot of that to the expertise of my doctor, who is Dr. Joanne Stone at Mount Sinai, if you need a great doctor.
So in reflecting on your time working at Marxe's Career Services, are there lessons you've learned in your journey that you'd like to share with the Marxe community?
Absolutely. Even going back to our earlier discussion about reaching out to people, and how did you just start reaching out to like national figures? I encourage, when I was in career services, and even now, of course, I would still encourage people, reach out to professionals in your area of interest to learn more. One of the things that I noticed from students and alumni, which is not uncommon, it's not uncommon at all, is that people don't feel empowered to reach out to people. They feel like, why should somebody respond to me? And the answer is because they can help you and you have nothing to lose. But also a lot of people didn't feel empowered in their career. I am a career changer. I know that changing a career is hard. There was definitely, some hesitance as to, am I going to be able to switch my career? People didn't feel empowered necessarily to switch their career. And one of the lessons that I learned through this experience is, first of all, you are worthy. And also, you don't have to wait for permission from anyone to reach out to someone or do something, whether that's starting a nonprofit or volunteering. I'm volunteering every day now with Push. And there's so many things you can do, first of all, to advocate for your cause, and also get great experience to move towards the career of your choice. And I mean, I love Marxe so much because everybody in this school is a change maker. And I want everybody to feel empowered to do this. And if you're waiting for permission, I am giving you permission today. If you have an idea, go do it, go for it.
Those are wonderful thoughts to share. Diana, if you could please open up the chat, it would be wonderful for those of you all to who have questions for Marny to now put them in the chat. And while that's happening, I just want to thank you, Marny, for sharing your journey with us here today, because I know this has got to be really hard for you to talk about. And
thank you. Yeah, I first of all, I'm really happy to be here today, and especially with you, because as Jessica mentioned, she was the one who encouraged me to write to Health Affairs and try to get, something published. It's a very low rate of getting published. And so I thought, it's a long shot, but I'm just going to go for it anyway. So I really, really owe that to her. But also, as I said, everybody at Marxe is a change maker. I worked at Marxe, I'm an alum of Marxe. This is really my home. So I really feel, among my community being here.
Great. Well, while people are gonna put things in the chat, there was one question that came early, asking whether there are some things you do every day to overcome the loss of your son.
Sure. So I will say, you know, people have a lot of thoughts of overcoming. I'll just start with that, which is time heals everything. Time heals all wounds. When your child dies or someone close to you dies, that doesn't apply. And so, you know, getting over the death of your child or even trying to is not possible. So I appreciate the question because there are many things that I do. So I'm sure you can't see this exactly, but I'm wearing a necklace that says Heath's name and his date of birth. And on the other side of the charm is morning glory, which is his birth flower. And I grow morning glories. I keep them inside right now because they don't survive outside right now. But I have a candle that I light on special occasions and holidays so that he is with us. But the number one thing I really do is doing this work. And I think of this work as Heath and I are doing this work together, you know. So if we can prevent other families from going through this, that is really important to me. And I also will just mention, you know, it's really not just moms that go through this, it's entire families. And it really just knocks an entire family to the ground when something like this happens.
So there's a question that's asking, what was one of the biggest setbacks or maybe outreach that didn't work that you've had, and how have you overcome that, moved past it to stay motivated with the work you're doing now?
Oh, sure. There are a great number of setbacks. I'll just mention one that was particularly frustrating. So ACOG, which is the American College of OBGYNs, they are the organization that sets the standard of care in the US for all OBs. So basically they have guidelines around everything. Well, they should have guidelines around everything about basically management of a pregnancy for a doctor and what is typical and what is not. And the doctors very much stick to, here's the typical. And unfortunately, the typical is oftentimes the bare minimum, which of course I didn't know during my first pregnancy. So I thought, oh, let me go and talk to ACOG. You know, I had a meeting with ACOG and let me tell them about stillbirth prevention because I know so many doctors don't know about this. It's a silent crisis. And I'm sure that they will want to help me with my journey of stillbirth prevention. And what I realized was, first of all, the US does not care what other countries are doing. So if there's success in another country, they want to see it replicated here. So the fact that Scotland had reduced their stillbirth rate by 23% didn't care. And also, you know, another reason why they are not doing this work is because it opens their doctors to litigation. Basically, if they change the standard of care and people don't follow it, then they can get sued. And right now it's almost impossible to sue over stillbirth. So there are all these political and financial reasons why this is not getting worked on. And so, yeah, I mean, during my time, there were many setbacks as I had to learn how the system worked.
So there's a question from Suzanne Grossman, who you worked very closely with. What can we do to support stillbirth prevention and support this work? We, the Marxe community.
That's a great question. So, I mean, I would, and I see there's another question from Tracy. Hi, Tracy, who asked about like a newsletter. Mm-hmm. The first thing that comes to mind is this march that we have on Washington next year. You know, think of it as a smaller version of the Women's March, but we're getting a lot of traction if you are somebody, again, who believes in not only maternal health, but family health, because again, this affects families. We are going to march on Washington and basically make a set of demands. And by the way, people can also email me. I'm going to put my email address and let's see if I can send to everybody. Can I send to everyone? Yeah. I'm just going to put my email address. By the way, anyone can reach out to me about anything. And pushpregnancy.org is the nonprofit, but it's basically, awareness is a problem. Not talking about it is a problem. So if you thought this was interesting, but you don't want to be a downer and not tell your friend about it, I would say this can save lives, right? Like if you can talk to your friends who are pregnant or email me and I can send you materials to send to them, I would be more than happy to do that. And, just doing more research around stillbirth, which is also tied very much to maternal morbidity and mortality, and learning how, it's racism, it's sexism, it's all this systemic issues that we at Marxe, I feel like I've heard so many students talk so much about. So I'm happy to tell people more. And Samantha is now putting our newsletter in here. So, and you can follow us on social media, of course, and email me. I have so many things to tell you.
And Andrea is going to put links to the article that Marny wrote, as well as a link to the podcast where she reads the article in the chat in case you haven't yet seen it. There are a few other questions here. Nicole Wright said, thank you for sharing your story with us, Marny, and congratulations on the birth of your daughter. You are an inspiration. Can you share what is the mental health care being offered to families?
That's a great question. I would say close to none or none. When I was in the hospital and I gave birth to Heath, they gave me, a social worker gave me a packet with many support brochures for a bunch of organizations, which I didn't open for like weeks after I got home, because when your child dies, you're just in your own world, right? You're just trying to figure out how to get through each minute in the day. So basically they send you home with nothing, except brochures. So that is something actually, but really there's no, I mean, in terms of like mental health, even for live birth, there's not mental health help. This is another whole area around stillbirth that people are just starting to change right now. And so that's a great question. And it's the mental health part is everything. It's, I mean, they should give you a list of therapists, a list of psychiatrists. They should do so much more than they do. But if that's, by the way, if mental health is something you're interested around this, there's so much work to be done.
So let me see there. I just lost my next question. So there's a question about whether your organization plans to provide training to healthcare providers regarding stillbirth in higher risk pregnant people.
Yes, absolutely. So at the Rainbow Clinic, Push really partnered with Mount Sinai on this Rainbow Clinic. And what I mean by that is not only funded it, but created the training for the doctors. And the training has testimonials from different experiences that lost parents went through that were less than ideal, to say the least. And so we also offer that training to other doctors free of charge. So if you are interested, or your doctor's interested, or you want to let your doctor know that they should be taking this, again, email me, reach out, because we absolutely want to spread the word and get this training to as many people as possible, to not only save babies, but to really have pregnant people and their families be treated with dignity.
So Jonathan Alarcon has a question Well, he starts by saying you're amazing. And this reminds me the time when Bernie Sanders was running in the Democratic primaries and his stance was Medicare for all. In a speech, he connected infant mortality, stillbirth, and pregnancy mortality with people of color or a spike in diverse communities. Do you believe Medicare for all could help reduce the chances of these tragedies to occur?
First of all, hi, Jonathan, and you're amazing too. I think access to healthcare is a huge part of stillbirth prevention. I mean, definitely, first of all, COVID, I'll just use as an example, people who've been infected with COVID have a much higher risk of stillbirth than others. And during COVID, a lot of people are now doing like just virtual visits with their doctor, which doctor may or may not encourage, and not going in person, which I think is very detrimental. And one of the things that causes stillbirth is women don't have access to healthcare, or they don't have access to the proper healthcare. And even though I would say they don't even have access to the standard of care, which is the minimum of care. So I think that if everybody had insurance in this company, that could go a very long way in preventing stillbirth. Because if you don't have insurance and you don't go to the doctor, you might not realize any of the things you're supposed to be doing or any special medication you may need. There's just so many complex factors that go into pregnancy, and seeing your doctor is so important. You know, there's also, I'll just mention a big movement around like natural birth. And I won't go too far into this debate. It's a whole nother debate, but I'll just say nature is a terrible obstetrician.
So there's a comment here from someone who knows two other women who have suffered stillbirths and wanted to know if you're working on ways to share this information in non-medical contexts as well, like friends to friend.
Absolutely, yes. So first of all, I'm so sorry for your friends, and please email me and I can send you information. But basically, we have one of the main things that we do is we have materials. I'm actually working on a store right now so that patients can order these materials for free, as well as doctors, but with information about stillbirth, because I received zero information about stillbirth. It was not mentioned to me at all. Even it's, people say that it's rare, it's a fluke, but it's actually way more common than that. And so there are flyers on education around fetal movement, which a doctor may or may not tell you about. And fetal movement is important because it's the only way that your baby can communicate with you. And so if a baby has altered fetal movement, it could be a sign of distress. You should definitely go to your doctor right away and not wait like I did until the next day, because no one had told me and I didn't know how serious it was. But yeah, there are also other things you can do. And so we have flyers, we have materials. And I think just also, I know it can be uncomfortable having these conversations with friends, but it's important, and you'll actually realize that a lot of your friends, even if you don't know that they had losses, they have had losses. 1 in 4 pregnancies ends in a loss, miscarriage, stillbirth, something else. And so I think if you are brave enough to start a conversation about it, people will have plenty to say.
So there's someone in the chat who said she's a second-year medical student and wondered what you would like to see doctors being taught from the beginning of their studies to better serve patients experiencing stillbirth. And also, what else would you suggest we can do as students to advocate for patients?
Wow, that is a truly amazing question that I wish every doctor would ask. So this is great. I think that, it's interesting because I talked to a family friend who's an MFM, and MFM stands for maternal fetal medicine, which means a higher risk doctor for pregnancy. I talked to somebody who is doing his residency, And I asked him what he was learning about. And you know, I told him about my stillbirth, and I told him about, like, this was at the very beginning, after Heath had just died. And he was so not interested. I think basically he was being taught that, again, like, stillbirth is rare. And it's not going to happen to many patients. There's nothing you can do to prevent it anyway, which is mind-blowing to me, when you have 23,000 babies dying. I will put in the caveat that push and my mission is to end preventable stillbirth. Not every stillbirth is preventable. Studies show that, like, minimum 25%, as high as 50% could be preventable. So I think that, I mean, I wish, by the way, I'd be happy to talk to your professor, or have a doctor talk to him. But yeah, education about fetal movement needs to be taught to all patients. Also, doctors, a lot of times we hear why patients are not educated about this is because they don't want to make the mom anxious. And it blows my mind, because, you know, would you not tell a cancer patient about their risk of cancer, like, about that they have cancer, because it's going to make them anxious? That doesn't make any sense to me. Like, spreading this information is about informing, educating, and empowering women. And a doctor should not get to decide what makes a woman anxious. It's so paternalistic. It's on and on. So I think that doctors who are teaching, they need to be better educated on stillbirth prevention. You know, they need to be taught that there are ways to prevent it. Also, they should be receiving bereavement care so that they know how to talk to patients if a stillbirth does happen. I talk about in my essay, you know, my OB was talking to me about the next pregnancy while I was giving birth to Heath, which was not appropriate, and so dismissive of the fact that my child had died and I was trying to give birth to him. So these are great questions. And what else do you suggest we can do as students? I think really you can even just give patients a talk about the fact that they know their bodies well and they can trust their intuition. If they feel like something is off, go to the hospital. Don't feel like you're going to be that annoying patient or that crazy, hysterical pregnant woman, because you are not, if you are concerned about your health and the health of your child. Especially because I know that there are so many things that pregnant women should be taught that they aren't. So if you can, you know, first time you meet a patient, I would say, let them know that you are partners in this care and that they can ask you anything. They should let you know about any concerns. And they should be really encouraged to ask questions, encouraged to understand their care. And I'll also say, okay, saying one more thing, I'm going to wrap it up. You know, when you go to the doctor, a lot of the times, like, you'll go for an ultrasound, or this could be true for anything in healthcare. Like, you go and they're like, everything's fine, but they don't say what everything is fine, or they don't say what they measured. They won't say what the percentile is. For example, Heath was growth restricted, and when he was born, he was in the 4th percentile for weight. That's very, very low. That's dangerously low. And he died because it's dangerously low. There's no growth scan in the 3rd trimester. So my doctors didn't know that. And growth does not fall off quickly. It happens gradually over time. They could have caught that. So thank you, and email me.
I think on that note, I just really want to thank you, Marny, for being here, for sharing your journey, for the change you're trying to make, and for trying to empower the rest of the Marxe community to go out and make the world a better place. So thank you all for being here, for your excellent questions, for being engaged members of the Marxe community. And I hope that Marny's actions inspire some of you to make the change you want to make. Thank you all. And Marny, you should read the chat because it's really lovely.
Okay, I'm going to copy it. Don't close out the session yet, guys. Let me just. Oh, no, there's like 3 new messages. Oh my gosh, you guys are amazing. Thank you so much for saying thank you and all of these kind things. And for being here, because I know that this is a real specific topic.